I'm Greg Friese, a host of the International Journal of Paramedicine podcast. I'm pleased to welcome Jasmine Kayanja to talk about an article that Jasmine and other authors contributed titled The Implementation of Mental Health Supports for Canadian Paramedic Students During Practicum Placements. Jasmine, welcome.
Thanks for having me.
Happy to. Can you just start out by telling us about who you are, the work you've done, and then briefly what the paper is about?
Yeah, so my name is Jasmine, and I co-wrote this paper with some other students. And so it started as like part of a summer research related project. So we wrote a paper about how important it is to have mental health support for paramedic students during their practicum. And so we just looked at different strategies that can be implemented to help these students. And yeah, that's basically the
Yeah.
entire paper.
Okay. And what is your field of study, Jasmine?
I'm currently majoring in immunology and infection at U of A.
Okay. And how did you get from that field of study and become a part of this project?
Well, I joined under the summer research studentship, and so as part of NATE, this was one of the projects that we as a group of students we came up with during like the research process, and so we were able to put it together.
Okay. That's great. So I know in the paper you called it a position paper. Can you give us a quick summary of the of what your group did and then, why did you want to write on this topic?
So, really, it came from listening to the reflections that paramedic students had from their practicum experience. And so we started looking at different themes that came up. And we started noticing a lot of students were saying that I wish I had more mental health support. I wish I had someone I could talk to during the process. So then that steered us towards okay, let's see like what available information there is about like supporting students during the process. And so we tried, there wasn't like too much information focused on paramedicine. So the more we looked into it, the more we saw, okay, these are like under first responders, these are the different things that they deal with. And we started to understand that, okay, as students are going into these experiences, these are real life scenarios that they're facing, but they're students. So they need some kind of support along the process. And so that's how we started writing this paper, and it developed from there.
You write that paramedic students may be at especially high risk for stress, PTSD, depression, and anxiety. What makes students particularly vulnerable during practicum and then their early transition into practice as a paramedic?
Mainly, it's the fact that they just lack experience. So, like, for many of them, this is the things that they face. This is the very first time that they're in this kind of serious situations, like going out on practicum, and for the first time, they're the things that they've learned in the classroom. Now they have to apply everything that they have, but they don't have any like prior experience to fall back on and like okay, I've developed a system for how to handle my emotions once I face this. So them being completely new to the experience makes them more vulnerable, so that's why they need more support.
Okay, yeah, that makes sense. Maybe your first time seeing a dead body or witnessing somebody die or be severely injured. And then you also write that sometimes there's pressure to not seek help or to ask, say, a training officer or even their classroom instructor.
Yeah, so basically that the concept of like you should be able to handle this on your own, and like you will have to like build a like for yourself, you have to face it. It's just part of the job. This isn't something that we discuss or talk about, so like you have to just take it essentially. But that's also in that is part of the problem, because that's how a lot of people end up suffering in silence. So there has to be a way to like let's have the conversation.
Yeah, I agree. So the paper is organized around four pillars of support. Can you just give us a high level of what those four pillars are?
Yeah, so the first one was proactive education. So basically, like, we just need to like make it more of a topic that students are trained on. Like they need to develop that understanding while they're in the classroom. And then the second one we talked about was mental health care providers needing to be more specialized towards paramedicine so that they can provide better support, better help to the people that they're actually addressing. And then our third major point was about social support. So that's with students and their families, that's with students together. Because, like I was saying earlier, having that conversation with people who are like having it together like, in community makes it a lot easier to talk about these things. And so when we educate students more and we build more of that community social support and we bring in their families so that they know how to help students as they're going through this process, like having a support group will just make it easier for them. And then we also talked about the transitioning from practicum and early practice, so like translational support. And so basically, like as they're going through the process, like transitioning into actual practice, the need to have more more involvement from like preceptors and from like their community altogether so that as they're like we're building them up to the process kind of thing. So that's where like more of that mental health support and training needs to come in before they actually step out into the field.
Yeah, it's really interesting to think about how a paramedic student goes through a really stressful experience of completing their training, the practicum, the high stakes examinations to get certified and then licensed right into something that's high stress, starting a new job, learning all the ins and outs of that job, plus having a field training period where they've got to get credentialed, where there's also high stakes. And if you don't have anything to help you along that way, you're just accumulating a lot of stress. You wrote about paramedic education as the first pillar. Did the group a did the group have an insight as to whether that education should come as a bolus, kind of like an all at once dedicated class, or should it come in, periodic micro doses throughout training and practicum?
It was more that it should be integrated into the curriculum more. So like over time as they're practicing, but also like as part of the course or like and more of the bits and pieces along the way, like as they're moving more towards their practicum. So like not just everything at once immediately, because it's a process. Like as you learn, as you practice, then you also develop those skills to handle your own mental health. So it was more of a like bit by bit kind of idea.
Yeah, yeah, the microdose. I like it. Of the four pillars, which one would make the biggest difference fastest for paramedics?
Um, I think like okay, in my opinion, I think having social supports would be the biggest because by doing that, we're among the students and then students and their families. So, like by building a community of people who, hey, we're all having the same shared experience. So, like, let me reach out to these people and then we're able to like come together, find solutions. So, I think having that among the students themselves is particularly important because they're all facing the same thing. But then also the aspect of like involving their parents as well, because familial support can also like it's essential for students to also have that. And so if families know these are the strategies for how to handle the students' mental health, these are the ways that we can help them even outside of the classroom, then like just having a community makes it easier to go through it's like these kind of serious situations. So I think that that would be like an important place to start, definitely.
Yeah, it reminds me so much of my own experience more than 20 years ago, and just all the different situations our class of people was coming from. Some people, I was already married and had my first child on the way while I was in paramedic school. other people had jobs, were trying to work full time while also going full time to school. Some had been to some college before, some not. Still a lot of different stresses, but there was a lot of bonding that happened in the class. And we probably could have been more intentional about creating community and supporting one another. Did your group look at any real practical steps? And I'm thinking as specific as possible, something practical that you would recommend first for students and their social networks to better handle the stress and mental health challenges that come from being a paramedic student.
I think if we can inform students as soon as possible of all the resources that are available to them, that might just make it a lot easier because at the onset, it might not be so easy to get people to like open up and share their experiences. But if we can make it very clear early on that if you've gone on your practicum and you find yourself struggling with your mental health, this is someone you can go to. These are the places where you can seek help. And we just make that as clear from the beginning as possible and encourage students to, even if you're by yourself, you don't want to share this with anybody, you don't have to suffer in silence. I think that that's a very realistic, practical thing that can be done. And even at like the beginning of the school year or like over the course of the bit by bit practicum experience process, to like when people are aware that there are places that they can seek help from, then they can go get help.
Yeah. I think that's also is a recommendation for the instructors and institutions to make that resources available. What other recommendation, practical step would you recommend for the paramedic instructors and the institutions they work for?
For the paramedic instructors themselves, I think so as part of the like translational support and like transitioning the students towards like actually entering into practice, then there can be some kind of collaboration with like the instructors themselves where even they can use like their own experiences to like use that to explain to students the different strategies that they can use to manage their own mental health. And then by combining that with like institution related support, then like the goal also being to like destigmatize any kind of attitudes surrounding mental health so that it doesn't become a thing that blocks people from actually seeking help. So when we have actual practicum instructors and institutions themselves sharing their experiences and like maybe even starting initiatives like specifically focused on mental health and paramedic students helping them, I think that might be a good idea.
Yeah, outstanding. Jasmine, what kind of research would your group like to see happen next, building off the work you've done?
I would definitely like to see at least like one of these strategies being implemented, introduced into any like paramedic focused institutions, and then like reviews over what the experience looked like. Are there any areas that need changing? Is this actually something that's feasible to employ in schools? And so seeing more research done into even things like how the attitudes surrounding seeking help in paramedicine have changed, because that can give more insight into what needs to be done more so that students are encouraged to seek help rather than hindered by standards surrounding basically like you need to do this on your own. So but ideally, if any of these strategies can be fully implemented and then revised and rehearsed to see what can be improved.
Yeah. Jasmine, this has been a terrific conversation. I've learned a bunch. Is there any final thoughts you'd like to share with our audience about paramedic students and their mental health?
I think it's something that, honestly, from going over the literature and seeing that there's really not much information about it, that was kind of concerning. But I think that it definitely needs more attention, but also by allowing students to have these strategies where they can seek help, it will just like it makes the transitioning process into actual practice smoother, and then it continues from there as they themselves begin to like develop their own experience and become like full practicing paramedics. So I would say definitely like there is much more need to like educate people on this. There needs to be more awareness to the topic so that we can actually start like implementing real solutions.
Mm. Jasmine, thanks so much. I wish you the best with your continued research and academic pursuits.
Yeah, thanks for having me.